All right, welcome to the show, and in relation to World Radiography Day and the discovery of X-rays, we have our guest, who is Mr. Chudy Iloani, who is a team manager, Radiotherapy unit at the NSIA-LUTH Cancer Center. Welcome to the show, sir.
Thank you so much.
And happy celebration of World Radiography Day. And the theme, or what we're talking about, is the contribution to healthcare and cancer treatment. World Radiography Day. So let me first ask, someone might be wondering, what are these people talking about? What is radiography? I go to the hospital and maybe I'm getting certain symptoms and they say it's this and I need to have radiotherapy. Yeah. But first, I want to know, what is World Radiography Day all about?
Thank you so much, Tolu. My name is Chudy Iloani. I'm the team manager Radiotherapy. This should be about my 3 decades of practice in radiography.
Okay.
X-ray actually opened vista for so many health diagnostic modalities and therapeutic. In November 8, 1885, there's a German scientist, William Conrad Röntgen. He wasn't actually working to discover X-ray. He was using cathode ray to see whether the ray could pass through glass. He positioned. So while he was working, he noticed there was a glow coming from the chemical coated screen by the side. So he started wondering what could cause this glow. So further research established that the glow that was coming was an unknown ray. And they called it X-ray, unknown, X-radiation. So that was how X-ray coming to be.
Okay.
And it was first used in 1897 during the Balkan War. And unfortunately, while there was euphoria about the discovery of X-ray, they didn't think about the later aspects, the side effects. It was years later that the early workers of radiation started noticing burns on their skin and skin disformation. Early workers equally suffered cancer and whatever because they didn't know what was happening. It was then research started to establish what was actually causing all these issues, right? So they now realize that even though this radiation is good for mankind, it has some little effect. So that was how need to protect personnel. Okay,
so what do radiographers generally do?
Radiography is a very broad spectrum. Radiograph has evolved over the years. Initially, it was just to take images.
Okay.
But over the years, we realized that it could be used in treatment. Even though X-ray is dangerous, you can use it to treat cancer.
Okay.
Even in radionuclide imaging, CT scan, so many areas.
Okay.
So without diagnosis, medicine is just quackery. So we've realized that the bedrock of modern medicine has to do with X-rays and the professionals.
So radiographers take X-rays?
We take X-rays, we treat with radiation, we do so many other things.
Okay. Yeah. So you are a radiation therapist. What is the difference between a radiographer and a radiation therapist?
Okay, basically, all of us are radiographers, but during the course of training, some people specialize. Before you can become a radiation therapist, you must be a radiographer. So radiographers are people who take, who are into diagnosis. They take diagnostic images, they do CT, they do X-rays to produce medical imaging that is good for diagnosis.
Okay.
In radiation therapies, we treat with radiation. In radiation therapy, we have radiation oncologists, the people that manage cancer cases. They review patients and know whether they could benefit from radiation, chemotherapy, or surgery. So when there is need for radiation, it's the radiation therapist that treats these cancer cases. And while you are treating, you still have to protect the patients and personnel.
Wow, okay. So you totally broke it down for me, because one just takes imaging, the other one actually helps to treat
cancer cases.
Oh, but what it seems, because we have let's say the number of cancer cases are growing in Nigeria, and but we don't have enough radio therapists.
Yeah.
Why don't we have enough?
Actually, until recently, there is no institution that trains radiation therapists. Most of us trained abroad. And it was only recently, about 2 or 3, about 5. Okay, the first set of radiation therapists was trained by Radiographers Registration Board of Nigeria in Ibadan, and that was about 10 years ago. Then recently, there was robust need to train personnel, because you see so many centers are coming up. We don't have professionals, and most professionals we have are getting off abroad, so they don't stay.